osteoarthritis obviously affects the entire body. For patients who have back issues, hip issues, knee issues, how should they think about the sequence in which to get joints replaced? Let's say they need knees replaced and hips replaced.
The question is, if you have multiple bad joints in your body, is there a best order to have them treated, especially if those treatments might include surgery? Usually my response is that there are joints in the body that can cause pain that may be referred to other locations in the body, and then there are joints that typically cause pain just around the joint. So of the things that I do, and we're talking about hips and knees, the knee tends to cause most often pain right around the knee. It doesn't as commonly refer up or down the leg compared to a hip. The hip oftentimes can cause pain around the hip itself, most common in the front of the hip, but it can also cause pain that goes down the thigh, most commonly the front of the thigh, and to the knee. Not as often below the knee, but all along the front of the thigh and even including the knee. So if someone has a really bad hip and a really bad knee, I usually will recommend that the hip be done first. And that's because there's a good chance that fixing the hip might help address some of the knee pain. The other benefit is that on average, hip replacement recovery is a little easier than knee replacement recovery. But there are times when I have seen patients that have a bad hip and a bad knee, but the knee is so much worse than the hip, and through exam and testing and history taking, we feel confident that the knee itself is the cause, predominant cause of the knee pain. And in that case, you may elect to have the knee done first.